G'day, Ashley here. This video is just to discuss a very common condition people often get relief from here at the clinic, and that's sciatica. So sciatica is compression, irritation, or direct trauma to the sciatic nerve, and the resultant effects from that. So a little bit of anatomy. The sciatic nerve is these two little nerve roots, along with a few from the sacrum here as well. They all bundle together to form the sciatic nerve, which runs down through the buttock, down through the back of the leg, into the low leg and the foot. It supplies most of the skin around the leg, and except from a little bit at the top, and then a few of the muscles around the low leg and foot as well. So there can be many different causes for sciatica, but by far the main one is a disc bulge or disc herniation. One of these little red guys here, pressing on the nerve root that runs past it or below it. Why is that important? Why is compression important for a nerve or sciatica? So if my nerves innervate a certain area, like my ulnar nerve supplies the side of my hand here. If I rub on that, that information is picked up by nerve endings, sent via the elbow back up to my brain, and my brain interprets that as rubbing. If I hurt it, if I get stabbed there or something, or cut it, my brain interprets that as danger and tells myself, my conscious me, that I'm in pain in that area as well. If I bang my funny bone here, that same nerve that supplies that area, if I activate the nerve here instead by banging it on the corner of the desk, my brain doesn't know that I haven't been hurt here. It just says that's a lot of nerve signals coming from that area. That must be painful. So you feel pain in that area when nothing's happened there. That's sciatica. You've banged the funny bone of your back. So if you activate the nerve down low here in the low back, you get a radiculopathy like your funny bone, but it's down the leg instead. So what can you do about it? So I'll run through a couple of nasties that you should go to your GP for straight away if they're there. If you have the pain associated with changes in bowel bladder habit, numbness or tingling or pins and needles anywhere you contact a saddle or sitting on a saddle, or cannot walk on the heels or toes, just weakness in that foot. Go and see your GP straight away, don't muck around with those. In the absence of those, you've got pretty standard sciatica, and there's lots you can do for it, but a diagnosis of what's causing it's very important. I focused on the disc today because it is the most common, but there are other different causes, and exactly what is causing that sciatica will dictate what we do for you and what you can do for yourself. I'm going to run through some low back pain exercises in the future, and I will incorporate a very special one for sciatica in that as well. So keep an eye out for that one. Otherwise, pop in and see someone and get it sorted. If you have specific questions, put them in the comments below, and we'll put a link to our website there as well if that helps. Thank you.